Not enough personal protective equipment, no danger pay, no counseling, and the constant fear of contracting COVID-19 and infecting loved ones. Rich Sicina, who is the Secretary General of the Young Nurses INDABA trade union, says this is the burden that himself and his colleagues carry every day. Sicina says, however, that the public healthcare system was a mess even before the deadly virus.
Remember, COVID-19 came into South Africa already, like I was saying. Public healthcare system was already in tatters. It was facing long-standing challenges in terms of shortage of staff, structural problems, lack of material resources.
Health Minister Dr. Zweli Mkhize announced in the first week of January that South Africa had secured the procurement of 1 million COVID-19 vaccines that would be available as early as February. This has, however, been met with skepticism, and the Young Nurses INDABA say that they will be boycotting the vaccination of healthcare workers should government not meet their demands. These demands include transparency from the government about which clinical trials have been conducted on this vaccine.
We want to know how many trials did this vaccine went through in terms of clinical trials. And we want the results of those clinical trials. How many doses are we going to get? What are the reactions? The adverse reactions, more especially the deadly adverse reactions of this vaccine. We don't see that. We want them to come out and say, this is what we need to expect.
Sicina says that no information on the adverse effects of this vaccine have been communicated. The Young Nurses INDABA is also demanding that Resolution 1 of 2018 be implemented. This is an agreement on salary increases. They're also demanding that a COVID-19 risk allowance be provided, as well as a 6-month income tax break to act as a token of appreciation for frontline healthcare workers.
It's working as a nurse in South Africa. It's stressful. It is very stressful. What's stressing us most is the community of South Africa. South Africa, we always say as Young Nurses in the trade union, South Africa is a continent on its own. There is everyone in South Africa. The population is increasing immensely every day. It's crazy. Our facilities are full.
Sicina says that public hospitals are still grossly understaffed and have no material resources. He states that healthcare workers are dejected, demotivated, and tired.
We see people dying and we are helpless. There's nothing we can do. You run around looking for things. We want the authorities to build hospitals. They must build new structures. They must build new structures. They must hire more nurses. They must hire more doctors. They must give us material resources.
Sicina says that the aim of the Young Nurses INDABA is to bring the pride back into the nursing profession. He said that even though other nursing unions have not come out in support, they are in agreement about the demands which have been made. What remains to be seen is whether or not the government will attend to the cries of those people who have put their lives on the line. For MPK TV News, I am Lele Tungapi.